we're really excited to introduce to you Carrie Ham from Lakeland University. And Carrie, we usually just kind of start out with the same question each time, and that is just share with us your career journey, especially because it sounds like there was probably a few different stops along the way, and sort of how you came to get to be where you are, and maybe some of the decisions and situations that led you to make the choices that you did.
Absolutely. Thank you, Candace. So welcome, everybody. Like Candace mentioned and Julie mentioned, I'm Carrie Ham. I'm the director of the nursing program at Lakeland University. I've been a registered nurse for 25 years now. So I have a bit of experience in nursing and in nursing education. So my pathway to nursing was a little bit wavy and a windy road. And so don't get discouraged as you're following your path to nursing. So I started off after high school. I went to college and I thought I wanted to be an accountant. So I went to one of the University of Wisconsin schools and I started pursuing accounting. And it just didn't really feel right to me. And between my junior and senior year, during that summer, I decided to take a job as a nursing assistant. And to do that, I needed some education and training. So one of the nursing homes in the area that I lived offered a nursing assistant course, and then I could work at the long-term care facility or the nursing home as a certified nursing assistant. So I went through the training, I became certified, and I started working as a nursing assistant that summer. And I absolutely loved it. I loved working with people. I loved caring for others. I found that it was extremely rewarding. So my career path changed. I decided to not continue on that pursuit of accounting, and I continued to work as a nursing assistant. And after about a year of working, I realized this is really what I want to do with my career. And so I went back to school and I decided that I was going to become a registered nurse. And there are lots of different pathways for education for nursing. And so I went to Ohio University and they had an associate degree nursing program. Much like the technical colleges in the state of Wisconsin offer associate degrees in nursing. And I started my education journey through that program at Ohio University in what's called Chillicothe, Ohio. Finished my associate degree in nursing in about 2 years and became a registered nurse. I took the licensure exam, became licensed, and started working at a hospital in Southern Ohio. And I did that for a number of years and went back and then pursued my bachelor's degree. And what was beautiful about that was my employer helped pay for that bachelor's degree. And so I was able to take advantage of tuition reimbursement and continue on with my education, all while I was working. So I was in my early 20s, I was working and I was going to school, earning my bachelor's degree. The hospital that I worked for was paying for that. And then I earned my bachelor's degree. I'm originally from Wisconsin, so my family moved back to Manitowoc, where I live now, and continued to work at the local hospital in a couple of different areas. And I can tell you about my career experience. After I'm finished sharing my educational journey, I thought, I really want to be a nurse educator. It's kind of the best of both worlds. I can still work in nursing, but then I can also be an educator and educate nurses so that they too can fulfill their dream and become a nurse. So I started teaching and going back to school for my master's degree. To be a nurse educator, you do have to have a master's level degree in nursing. And so I started pursuing that while I was doing a little bit of teaching in a nursing assistant program and also working at the hospital. Finished my Master of Science in Nursing from Bellin College. Some of you may have heard of that. It's in the Green Bay area. And then I started teaching full time. And my educational journey has not ended. I am back in school again during this pandemic, and I'm pursuing a PhD in leadership studies and student personnel services. So we continue on with our educational journey as nurses for lifelong learning. So
that's wonderful. Congratulations.
Yeah, thank you. So now should I share a bit about my nursing experience and where I've worked as a registered nurse?
Yeah, that would be wonderful because students, depending on how much you know about nursing, there really is so much variety. So I'm excited to hear what your experience was and maybe also how you chose those pathways that you ended up with.
Okay, great. So like I said, I started off as a nursing assistant in long-term care, and I really liked working with folks that needed some assistance, and they were elderly, and they were actually, super nice, and it was just really fun to work with them. And then when I went into nursing school, I had a taste of some other experiences. And that's the beauty, one of the beauties of nursing school is you'll get in your clinical experiences opportunities to try different areas of nursing. And what I found was that I really enjoyed heart care or cardiac care. I loved learning about the cardiovascular system. And so I ended up, my first position as a registered nurse, I was working on a step-down unit, and that's an intermediate care unit. So it's between a medical surgical unit and an intensive care unit. And we cared for a lot of patients who had cardiac or heart issues and respiratory problems. And I just loved it. And then after a couple of years of doing that, I thought I'm going to dip my toe in the water and I'm going to work in the emergency room. And so I started working in the emergency room, and I did that for a couple of years. And that was really quite a challenge because you see all sorts of patients who have all sorts of needs, in an acute situation where they really need assistance right now. And so we would see the whole spectrum of patient needs in the emergency room. And after working in the step-down unit and the emergency room, it was time for my family to move back to Manitowoc, Wisconsin. And so when we moved back, I thought, I'm gonna do a total change of my career path. And I thought I'm going to do labor and delivery. So I started working on an entirely different unit and working in women's health and labor and delivery. Very different than the emergency room. But what I was looking for then at that time was most women and families who come into labor and delivery are pretty happy. And so I was looking for something just as challenging, but also maybe a little more upbeat and happy. So I started working in labor and delivery, and I still keep in contact with some of the families that I was their labor and delivery nurse. And when I see their children now and they're like 15 years old, it's a little odd, but it's also very rewarding. So after doing that for a few years, I really missed cardiology. So then I went back to where my heart really always was in cardiology. So I started working and in the clinic setting with cardiologists, and then I started managing the clinic and being a cardiac nurse again. Through that, now I'm an educator and shifted from that and started dabbling in education, teaching nursing assistant courses, and now working full-time in education and on occasion doing some practice at the bedside.
Wonderful. That's fantastic. I actually would like to touch on your experience in labor and delivery. And the reason for that is we really haven't gotten into that specific department yet with any of our guests. Well, I'm curious, which hospital in Manitowoc were you at Holy Family or Aurora?
I was actually at both of them.
Oh, both of them. Interesting. Interesting. So I delivered my babies in Manitowoc at Aurora, but I think if you would describe the day in the life of a labor and delivery nurse, because I think even, as a patient going in there, I was surprised by what the nurse does compared to what the doctor does during, the whole process of a woman coming in to give birth. So if you want to give us a day in the life, that might be really great insight.
Absolutely. Now, a day in the life is ever changing in labor and delivery. So what happens is we would keep a log of women in the county who were pregnant, who were going to deliver their babies at the hospital where we worked. And so we kind of could plan staffing a little bit based on those due dates. So we'd keep this log, and we could see that this week we probably had about 5 to 10 deliveries that we were going to have for that particular week. So we could kind of staff a little bit based on that. But then during the day, we'd have really kind of 3 to 4 different types of patients on our floor. We would have newborn babies who had just been delivered and were still in the hospital. So we would have babies in the nursery. We would also have the postpartum moms, or the moms who delivered their baby. And then we would also have the laboring patient, the laboring mom who was in labor preparing to give birth. And then we would also have patients on the floor, often women who had some gynecological surgery. So maybe they had a uterus removed, and then they would come to our floor for their postoperative care after that gynecological surgery. So we really had those type of patients. So we would work between the different patients. Now, if I was assigned to labor and delivery for the day, that would really be my role, because in labor and delivery, you are really focused one-on-one with that woman and her family. Sometimes you might have a second laboring patient that you're caring for if they're in their early stages of the labor. As women progress through the laboring process, it becomes more intense. And so then it becomes one-on-one nurse and patient time. And the nurse really takes a lead role in helping the patient through that laboring process, through making sure women are going to the bathroom, that they're safe, that they're getting up, and then all the way through to the actual delivery. Now, the nurse will reach out to the provider, the healthcare provider who comes in for the delivery, but sometimes that's only for the last hour when the woman is pushing and just about ready to deliver her baby. So the nurses, they are really helping the family through the process. So that is one role. And again, if the woman is in active labor, it's usually a one-on-one, because you really need to be there supporting her. And otherwise, I might have 2 moms and 2 babies that I'm caring for. And I'm helping making sure that baby is bathed, fed, diapered, doing a lot of education with mom and dad, particularly if they're new parents, caring for mom after the delivery. And so I might have a couple of moms and their babies that I'm caring for. And then I might be assigned to the surgical patients as well who came up to the floor. So we kind of break up the patient loads in that way.
Yeah, that is super helpful. So even in labor and delivery, it sounds like there's still a lot of variety in what you're going to be doing on a day-to-day basis. So wonderful. That was a great explanation. Jaden had asked a great question. Is there any way that you can be an RN and still work in mental health?
Absolutely. There is a significant need for nurses who work in mental health areas. And so when you go through your training as a nurse, you'll have an opportunity during your education to work on a mental health unit and work with those patients. Almost all nursing programs have that as a basic requirement in the program. So you would actually get hands-on experience. And then as a registered nurse, you are able to move into that mental health, behavioral health unit. Of course, you can always go on and further your education, and you could become a nurse practitioner in psychiatric mental health. So there's that area of specialization as you move through your education, and then you can be an advanced practice nurse practitioner with psychiatric mental health background. So absolutely, there's a strong need in our state and across the country for mental health prepared nurses.
Oh, wonderful. Jaden, great question. That's not even something I've even thought about. That's a good one. That leads me to another question, though. Are some departments harder to get into, to find a position?
That's a really good question. So it sort of depends. So many nurses, when they're in their schooling, they'll work as nursing assistants, and some will work in a hospital or a nursing home that they know they want to work at for a long term. Some of the advantages of that is you already have some experience. And so when you're finished with school, that employer might say, you've had such great experience with us. We'd like you to move right into the emergency room and have that experience. Some employers will say, you've been a nursing assistant on our women's health unit for 2 years. We would like to bring you on as a registered nurse. So the other aspect that they consider is how seasoned their nursing staff is. So for example, on an intensive care unit, if they have a lot of nursing staff that have years of experience on that intensive care unit, and there's a new graduate nurse who really wants to work in that, they'll say, we have enough seasoned, experienced nurses that we can bring on a new nurse and train him or her for this role. So it's a hard question to give you a firm answer, but there are absolute opportunities.
Yeah, that makes sense. And you mentioned obviously you've been mentioning the training and mentioned it when you were talking about the mental health. In a nurse's training throughout their schooling, are they going to get experiences in like all departments? Or does it vary by school? How might they see all the different areas that they could become a registered nurse in?
Great question. So there are, as many of you know, there are a lot of areas that nurses can work in. Traditionally, we see nurses in long-term care or in nursing homes. We see nurses in hospitals. And then within those areas, there are specialty areas. So the emergency room, surgery, ICU. When you're in nursing school, you will have different experiences. I can tell you that in nursing school, all of you would have an experience in a long-term care facility. It might be one of your first nursing courses. Then you'll move into a hospital experience where you'll work on a medical surgical unit, for example. And there you'll see all types of patients who have pneumonia to patients who've had surgery on an abdomen, on a belly. And you'll see all types of patients. Sometimes you'll have experiences on an orthopedic unit where you'll take care of patients who've had hip replacements or knee replacements. Then as you move through those kind of general areas, oftentimes towards the end of your program, you'll get to work in some specialty areas. And sometimes students get to pick that specialty area. So if you know you want to work with pediatric patients, or children, then you would be able to have maybe a precepted experience on a pediatric unit. If you want to work in an intensive care unit, you might have a precepted experience in an intensive care unit where it's a little more focused, but that's usually towards the end of your nursing program where you have all of that strong foundation already built. So most nurses will also have experience in a mental health area. And a lot of programs do offer experience in women's health or labor and delivery for some experience.
Wonderful. Jenna is wondering what an OR nurse would all do. Would they hand the surgeon the medical instruments they need?
That's a great question. So operating room nurses or OR nurses, there are actually different roles for nurses in the operating room. So there's one role called the circulating nurse. And that nurse is a registered nurse who kind of holds a leadership role in the emergency room. He or she really guides the surgeon and the surgeon's assistants, which is called a first assist, will document everything that's going on. We'll look for breaks in sterile procedure, and we'll make notation and guide folks in that. So that's one role for a registered nurse in the operating room. The other role is a first assist. And I think this is what you're asking about. So there are nurses that are trained to be first assist, and they work with the surgeon, and they will actually assist with the operation. So they will hand the surgeon equipment. Sometimes they'll even suture up at the end of surgery. And so they have special training that they've gone through to suture up surgical wounds and go through that step. And they're really right at the side of the patient involved in that operation. That's a great question.
Excellent. So you've seen probably many, many nurses come through, schooling. Is there kind of a set of skills that you see over and over again that are going to make a great nurse? And then the second part of that would be, do you think there's additional skills that lend themselves to maybe certain departments?
You have all sorts of good questions. So I always believe that one of the foundations of a nurse is that she is caring or he is caring. They really want to help others. And so this kind of goes to some of Julie's introduction, where she was talking a lot about patience. And patience is caring. It is being present, it's taking time, it's understanding others' viewpoints, just being relaxed and calm. So I think caring is a foundation for what nurses are really doing and how we help others. Of course, we are all leaders as nurses. So sometimes I hear students say, well, I don't want to be a leader. Well, you really are a leader. If you're a nurse, you're a leader because you are helping patients. You are helping patients achieve their highest level of functioning. And to do that, you have to lead them. So you are a leader, but you're doing it in a different perhaps way than what you are accustomed to. So I think leadership skills are important for nurses. And again, you can be an informal leader. You don't have to take on the role of the charge nurse or the nurse manager. You can be that informal leader and lead your patients and their families and communities. So I think that is a good quality. You have to be committed. Oftentimes nurses give a lot of themselves. And so, again, as Julie mentioned earlier, be patient with yourself as a registered nurse too. Take care of yourself. You're going to take care of a lot of people, but you need to take care of yourself as well. I think that in different settings, you do have to take on different roles. As I mentioned earlier, if you're the circulating nurse in the operating room, you really have to take a lead role. And so that's not for everybody. When you are working in labor and delivery, and if you are helping a mom deliver, you really have to be enthusiastic, help women and families get through that laboring process so they can deliver their baby. So you have to be sort of a cheerleader, if you will. You have to be very knowledgeable in the areas that you're working in. So you have to study hard. Nursing doesn't just come to people. You have to learn and you have to study and you have to put your time in, but it's very rewarding. So yes, Excellent. There are different skill levels. If you work in the emergency room, you have to have a little bit different skill set. And so that was a change for me to work in the emergency room and move to labor and delivery because I was ready to be the cheerleader again and take on a different role. So
yeah. That's wonderful. And I, not to make this too long, but that whole labor and delivery, I'll never forget when I was delivering my daughter and I was in active labor and the nurse is right there beside you, just, contraction after contraction. And after I delivered, I found out she had a migraine that entire time that she was working with me, and I had no idea. She did her job so well. She ended up going home sick later on when she was done with me, but it was incredible, just the resilience that she showed without even blinking an eye that she was going to help me through that. So it was incredible. Jenna did ask a follow-up question. That first assist, that is also an RN position as well, correct? Yes. Okay,
It
great.
is.
Well, I know we have things to talk about with education as well. Obviously, that's your area of expertise nowadays. And if this is where your slides come in, we can certainly bring those up also. But maybe we can touch on what the steps are to getting into nursing school and becoming a nurse. How do we do that?
Sure. So when you're in high school, I would recommend you take some science courses to get a feel for, do I like science? Because nursing is an art and a science. So maybe an anatomy and physiology course in high school. You can also take a medical terminology course. And nurses in Wisconsin have training in nursing assistant. They don't necessarily have to work as a nursing assistant, but we do see students who have been nursing assistants really find the education component to be a little easier because they understand the terminology, they can interact with patients, they have some of those foundational skills to really be successful in their education. So if you're at all thinking about that, I would encourage you to find a nursing assisting course at one of your technical colleges or a local long-term care facility or hospital that offers that course. Sometimes it's free if it's offered by an employer, and that really sets you in motion for going on to school. You have a couple of different pathways to become a registered nurse. So there's really two pathways. One is to pursue an associate degree in nursing. And an associate degree is usually a 2 to 3 year program. All of the 16 technical colleges in the state of Wisconsin offer an associate degree in nursing. And then there are other institutions like Rasmussen, you may have heard of, Herzing. They oftentimes offer associate degree in nursing programs as well. And again, that's about a 2 to 3 year program. Once you're finished with that program, you sit for the examination that all nurses in the United States sit for. It's called NCLEX. And you take that examination. And once you pass that, you're licensed in the state that you live in. And another pathway is to go right away for a bachelor's degree. So a Bachelor of Science in Nursing or a BSN program. So you can attend a college or university that offers a Bachelor of Science in Nursing program, and you can have that traditional residential campus experience and pursue your bachelor's degree. Once you're finished with that, and that's about a 4 to 5 year program, once you're finished with that, you sit for that same examination that we all sit for. And when you pass that, you become a licensed registered nurse. There's advantages and disadvantages to both of those pathways. Some of it is cost, some of it is time, and some of it is, for example, a benefit of an associate degree nurse, and that schooling is the cost of tuition is less at the technical colleges than at some colleges and universities. You can get into the workforce perhaps a year or two earlier and start earning that money. Then those employers oftentimes help you with tuition reimbursement to get your bachelor's degree. The advantage of the bachelor's degree is you can have that campus experience and moving away from home. You can get your bachelor's degree at one time and you don't have to go between two different schools to achieve that. So there are advantages and disadvantages, a little bit to both.
Excellent. Yeah. And you kind of touched on this earlier. I think we covered that you really, once you have that RN degree, you really can do a variety of things within, healthcare. What other places can you go? So we're talking about education, right? Moving into being an educator, a nursing educator. You mentioned a nurse practitioner. Where, charge nurse, nurse manager, what do those types of roles require, and how would you kind of work your way into those roles?
Okay, so First, I'll start with a nurse manager on a unit or within a hospital or within a nursing home or maybe in public health or a school nurse. You can have an associate degree in nursing with years of experience. Some institutions will prefer a nurse who has a bachelor's degree to move into some of those leadership roles along with some years of experience. So it'll be advantageous for anybody, even if you get an associate degree, to get your bachelor's degree. That is what really drives the best care that we can give to the patients, is to have that bachelor's level of education. To become a nurse educator like myself, the Wisconsin Board of Nursing and our accreditation agency say that you have to have a minimum of a master's degree in nursing to teach, to be an educator. So I have a Master of Science in Nursing with a nurse educator focus. So I took courses in curriculum development and teaching methods and specific courses to education. Now, to become a nurse practitioner, that requires a Master of Science in Nursing degree as well. But then you specialize in. So I specialized in nursing education. A nurse practitioner can specialize in pediatrics, in adult health. You can specialize in pediatric. You can specialize in midwifery or nurse midwife. And you could specialize in nurse anesthesia and become a certified registered nurse anesthetist. So there's a lot of specialty areas when you advance your degree to that Master of Science in Nursing level and beyond.
Excellent. That's really good to know. And Jaden asked a great follow-up question. How long did a master's degree in education take, or maybe what any of these master's degrees?
It somewhat varies on the individual. So if you want to go through your master's degree at a pretty quick level, you could probably earn that in about 18 months. But some people may take 3 years because they're working, they have a family, and they can only take courses, 2 courses every term. So then they might take 3 years to complete their Master of Science in Nursing. So everybody's a little bit different. I can tell you it took me 3 years to go through my Master of Science in Nursing with a nurse educator focus. And I was working full time and had a family while doing that. So I had to balance both of those. So everybody's a little different. I can tell you for my PhD program, some folks will take 5 to 7 years, and I'm kind of busting through this during the pandemic, and I'll be done in 3 years. So I'm working really quick on that.
Wow, that is quick. Wonderful, wonderful. Well, students, we are going to be wrapping up here in just a little bit. And Carrie, if there's any last bits of advice that you have for students who are thinking about pursuing nursing as a career.
My last thoughts are thank you, thank you, thank you. I think you can't go wrong in nursing. You can work in nursing in IT. You can be a nurse in public health. You can work in schools, elementary schools. You can work in education like I do. There are so many opportunities. So take advantage of that. I look forward to seeing you and being your colleague one day. And thank you so much for joining us today.
Wonderful. Yes, I echo that. Thank you, students and educators, for joining us today. And Carrie, thank you so much for sharing your time and your expertise with us today.
Absolutely.
All right. Take care, everybody.